Hello everyone. I'm going to be taking things from the perspective of nutrition epidemiology and obesity research. First, I want to say that big data and spatial analyses came late to nutrition epidemiology. Transportation has been ahead of us for many, many years. Interestingly, I started my career working at a hospital in New York dealing with clinical obesity research. But these days, my closest collaborators are in the urban form lab, and they're architects, urban planners, transportation specialists, and geographers. And to some extent, obesity research has moved as well from a completely clinical setting and a focus on genetics to a much more public health perspective that has to do with the environment and also inequalities. So obesity is really being reformulated as an economic issue, and of course the environment that surrounds us is very much linked to economics, social demographics, and all the other components of what might be called big data. There's, however, one difficulty about applying big data to obesity research, and that is that data on obesity itself with good area coverage at a fine level of resolution do not actually exist. So you can go through big data from the census, and you get data on demographics and incomes and all kinds of other things. You can go down to mortality statistics from other sources, but the data on weight and height and behaviors and intermediate biomarkers and diet quality really are not there in the public domain. You have to go out and collect them yourself. So when you start looking at the various ways of mapping obesity, these are the iconic images that people have in mind. 20 years ago, when WHO started mapping obesity, I was very excited. I called them up and I said, do you have the data for obesity level by country? Because I'm very interested in that, trying to relate it to socioeconomic status, nutrition transition, and so on. And the response I got from WHO in Geneva was as follows. They said, yes, we have those data, but they are very sensitive to member countries. We can only give you data by continent. True story. And so I got the data by continent, and the data by continent said no obesity in North America, no obesity in Africa. That's as far as we've gone. Well, we've come a long way since then. But people still refer to maps of obesity for the United States by state. And those are the very famous maps from the Centers for Disease Control, which you have seen before, and you will see again, because the other people will be showing how obesity rates in North America are increasing and how some states are becoming more obese than others, and Colorado is still blue or green or whatever, and this is how it's going. I'm showing you those maps in order to say, forget you ever saw them, pay no attention to them. If someone is presenting them ever again, challenge them. They're perfectly useless. And there are a number of reasons why they are useless. First of all, the Behavioral Risk Factor Surveillance System, or BERTIS for short, is a telephone survey of the American public conducted every year by Centers for Disease Control with help and support from local and state jurisdictions. It is an anonymous telephone survey based entirely on landlines. Mobile phones are not included. Who answers landlines? Mostly retired, mostly not working, mostly with incomes of $100,000 per year. There's a gigantic bias. Don't trust those data. We don't like to use them, but sometimes we have to. But we don't like to. So the data that you have are at the level of states. Because, of course, people do not know what political district they live in. So about 10 years ago, BERTIS started being coded by county and also by zip code. Back about 10 years ago, only Seattle County was coding things by zip code. Other states were not. Now just about everybody is doing zip codes. So you can look at data, self-reported data for heights and weight at a final level of resolution. But because individual counties have to pay to ask BERTIS question, very complicated, you get county-level maps But again, county-level maps for births are modeled. So again, we have this discrepancy. On one hand, you have beautiful US Census data, we say income by county, and you get beautiful data on poverty by county from the United States Census. And you can use those data to draw very nice maps of area deprivation. There are a number of interesting indices of deprivation which are based on a number of indicators from the census. So the Sing index, for example, can be obtained at the level of the census tract and is based on census indicators of poverty, income disparity, single-parent families, home values, rent, ownership, mortgage, all kinds of social demographics you can get at a fairly fine level of resolution, in this case, census tract. What I'm showing you here is a map of Seattle and part of King County. Seattle is on this kind of isthmus between the Pacific on the west, Lake Washington on the east, Mercer Island. You notice here that some of the areas are much more deprived than others, in red. Mostly the deprived areas, what we call the I-5 corridor along the freeway, going from north to south. Seattle is richer in the north, poorer in the south, and quite rich to the east where Microsoft and the expensive waterfront states are located. So this is a kind of map of wealth and deprivation in Seattle based on census tract data from the census itself. Now, you'd think that you would be able to match that with some health data at the same level of resolution. Well, you can't. It's not easy. So in fact, the births data at county level are modeled. So take a look at this slide. So if you go from the nation, to the region, to the state, to the county, to the zip code or health planning areas, down to census tract, census block group, census block, and an individual tax parcel lot, you actually have reasonably good census data. You really cannot go down below census tract. It's not publicly available, but we have specialized centers that specialize in analyzing the census at census block group and census block level. But if you go down to, say, births to try and get some kind of health and weight data, you don't have it. You go down to zip code areas and there you stop, because those data are not really coded to find the level of resolution. Seattle King County is now experimenting with nearest intersection. There are privacy issues. You can't ask people their address. You can ask what is the nearest intersection closest to where you live. Again, remember, birth is telephone, anonymous, anonymized. There is no way of geocoding it at a very fine level. So even the census data, even the county level data from births are modeled. So for example, you start looking at a map of diabetes by county. This is a map from the CDC. They say it's county level estimates of diagnosed diabetes among adults. It is, of course, not diagnosed diabetes. The question is, has anyone in a health profession ever told you that you have diabetes? That is not diagnosed diabetes. It can be the hearsay diabetes. It does not really meet the level of medical diagnosis. And then those maps for diabetes and self-reported obesity are actually modeled, and they are using, talking about fancy names, Bayesian hierarchical modeling techniques, and they are using Markov chain Monte Carlo simulations to model the data, because of course there is no coverage, and some of the sparsely populated places have no respondents for births. For example, we did a check on those rich areas in Mercer Island. Whoever responded to a births questionnaire, in 10 years, nobody from a rich area in Seattle ever picked up the phone to answer the births survey. So we actually do have some of those data in Seattle. The coverage is poor and it has to be modeled. So what we're trying to do here is to remedy the situation and model obesity at a very, very fine level. So there are ways of accessing the big data that you want. So, for example, we said we would like to have data for Seattle looking at heights and weights. And there are two ways of doing that. You can go back to the archive births data and look at Seattle zip codes at that level of aggregation, reported heights and weights. We actually did that about 10 years ago. We published that saying obesity really was linked to zip codes. But since then, We have actually been talking to a big health insurer, Group Health, which is about 1 million insured people in Seattle, and they made available to us data from the healthcare system. Those were data not from, say, a cancer registry. Those were data from people who come for regular checkups at Group Health, who are not really biased by any kind of disease problem. They were just coming in for regular checkups. So those data were made available to us, but they were made available to us at a level of geographic resolution to protect privacy. So we could only get data for census tract, but we got data for 59,000 people for Seattle King County, which is really phenomenal. And those were data on measured heights and weights from medical records, 59,000 people at the level of aggregation of the census tract. We're now in discussions with Group Health to do a new generation of those studies when we want to get those data at the level of census block of finding. Group Health has actually geocoded all those data anyway, so they have the actual address, but we will not release it because those are medical data and that's many, many privacy issues. But for example, this is a map of obesity rates by census tract, which you will see tracks completely the deprivation map that we had earlier. Again, you see that there is very little obesity in the waterfront estates by Lake Washington, and most of the obesity is down in South County, which is poor. And so even though King County is supposed to be one of the healthiest counties in Washington State, there are huge within-county disparities in obesity rates, which are in the order of 600%, which is kind of interesting given that the disparities by race or ethnicity in the US are in the order of 50%, and here within Seattle King County itself, we're picking up disparities going from 5% in one area to 30% in another area, purely depending on where people live. And we've done something very similar with diabetes. This map was published in International Journal of Obesity Research, and this one here was published in Preventing Chronic Disease. And again, this is the first ever map of diabetes at the level of the census tract using health data from the healthcare system. So as we're doing those types of analyses at the level of the census tract, we were struck by the importance or the presence of social disparities, and we thought, how would it be best to capture the social disparities? Again, those are medical data. We know nothing about these patients except where they live. How could we characterize best their environment? And there are many ways of doing that, but I'll just zero in on the absolutely key thing, the one variable which tells you just about everything you want to know about the built environment, and frankly, this was house prices, which is an objective measure. It is a non-conventional database. It is very useful in Seattle King County, perhaps less useful elsewhere, because Washington State does not actually have an income tax. So most of the money that the state raises is from property taxes, which are kept absolutely up to date and adjusted every year as the property values go up. If they go down, interestingly enough, the tax does not decrease. And then you get a letter about, even though your property value has gone down, these are the reasons why the tax is still going up. So there's only one way. But anyhow, what we're finding is that as we were looking at education and income, notice that obesity is really linked to education much more so than to income. These are aggregate ecological data at the level of the census tract. And notice as we look at property values do as good a job as does education, whereas income is really pretty much not related. And so we find that for each additional $100,000 in added property values, obesity rates drop. So we thought, well, this is interesting at the ecological level of the census tract using aggregate data. Can we do something similar at an even finer level of geographic resolution? So here, these property value data, you can get them from the census, because you can get median property values or mean property values at the level of the census tract. But we actually don't like using census data. What we like to do is we like to go to the data from the King County Tax Assessor and get the data for everyone's home. It's in the public domain. We can get it. So we can then do our own maps for each of 6 million dwellings in Seattle at the tax parcel level, and we can aggregate them to any level of resolution. You want to do it at census block level? Check, at census block. Do you want to aggregate them to census tract? No problem. You want to aggregate them to zip codes? Done. But we do something much more interesting. And by we, I really mean the urban formula, because I don't do this personally. The urban formula does that. So what they do, notice here, first of all, we have mean dwelling prices by census block, and just pay attention to the fact that the waterfront properties are, of course, much more expensive. And properties on hills with a view are, of course, much more expensive. So you see this on the east side of the lake. That's where Bill Gates lives, you know, kind of waterfront estate right there. It's just about here. Everyone wants to know where Bill Gates lives. It's actually here. This is University of Washington, it's kind of low-income spot in a kind of higher-income area. And of course, the lower-income areas are over here. This is rich, this is rich, this is very rich, and this Microsoft is over here. So to give you some idea of the, again, demographics, this time the demographics are based on very, very granular objective property values from the tax assessor. So what we do is we actually get data from the King County Tax Assessor, we get data for 6 million dwellings, and then what happens is that the entire Seattle space is divided into a grid of 30 square meters. The computer moves to a point on the grid and calculates all the property values within a 10-minute walk. So every 30 meters, we calculate property values within a buffer zone, and the computer moves another 30 meters and recalculates and recalculates and recalculates and so on. And this is the kind of moving density function. And as a result, what we are able to obtain in the end is a smooth function of property values at each point in space, which is not aggregated by any administrative unit, which means we can then drop a point at any point in space and get an objective measure of neighborhood poverty or wealth. And of course, this starts looking like this. Those are Unburn Woodon's smart maps. Again, same structure as you have seen before, but this time this is not aggregated to any administrative boundaries. This is based on tax parcel lot data, 6 million units. We can estimate for each, for example, study respondent, the tax parcel lot value of where they actually live. It's like an individual measure of socioeconomic status. And then we can also calculate the value of all the properties, mean value or median value of all the properties within a 10-minute walk. And it gives us some idea of area poverty or wealth. So we use those measures in preferences to self-reported education and self-reported income. One problem, of course, with self-reported income is about 1/3 of the people don't want to give it to you, and so you lose 1/3 of the respondents in your study. Whereas with property value, you just have it. As long as you have the address, you can have the property value, it's in the public domain. So the advantage of the smart maps is that they do not have geographic boundaries, and we can use those in various studies. So this is how we set up the socioeconomic framework for some of our obesity studies. And then we come to the next issue, and that is, how do you get obesity data at that level of resolution? It cannot come from births because it's not coded below zip codes. It cannot come from the healthcare system because they won't give it to you, although we think now they will, which means that in order to resolve that problem, you have to get your own. And that takes a lot of time and a lot of effort and a lot of money. So we started the Seattle Obesity Study 1, SOS1, with an NIH grant from NIDDK, the National Institute for Diabetes, Digestive and Kidney Diseases, which has responsibility for obesity research. What we did was to use a telephone survey of 2,000 respondents, but this was a geocoded telephone survey, which means we knew where everybody lived. And so we were also able to send them a frequency questionnaire and collect all kinds of other data on their shopping and restaurant and eating habits, because we had destinations as reported by the respondents. So this is actually interesting in terms of the research on the food environment, because as you will see later, a lot of the research on the food environment has been dealing with nearest stores, the nearest restaurants, the nearest fast foods. And we said the nearest is not necessarily the one people actually go to, so we need to make the critical distinction between the nearest and the actual destination, because they may not be the same. And as you will see later, they were not the same. So here we got the telephone survey, we got the destinations for 2 stores or supermarkets, I think 1 fast food, and then the other thing that we did, we classified the grocery stores by market basket cost, because we're kind of interested in looking at the economic aspects of food access. So this is again a map of Seattle, and red is metropolitan Seattle, blue is King County, and these are the approximate locations of where our respondents lived. Again, for confidentiality reasons, we're not supposed to show a detailed map, but you can pretty much see we're getting a decent coverage of Seattle space, even though it was only 2,000 people. And then we then obtain another unconventional database that we use. We geocode every single food source in King County, all the restaurants, all the coffee stores, all the Starbucks, all the fast foods, all the convenience stores, and so on. And we get those data. You can get those data from Info USA. We actually prefer to get them from Public Health Seattle King County, because they license every location that is allowed to sell food. And again, their lists are kept up to date. So we actually like to get those data from public health authorities as opposed to from a commercial vendor. So what you see on the right here is all the food sources in King County. And of course, what's obvious here is that, for example, fast foods and coffee shops and so on actually do not locate around middle schools. As some people say, they actually locate along bus stops and transportation hubs and along freeways and suburban development, which anyone in marketing knows about. People in epidemiology sometimes do not, so pretty much you see downtown core and then freeways and arterials for the development. So again, we look at where the various locations are cited. So here what we were looking at now at the individual level were 2 things. First of all, we found that property values were predicting obesity, mostly in women actually. The fit of the model for men was not nearly as good. So property values were actually much more predictive of obesity than was education. And the differences were really very substantial. And then we looked at something else about the neighborhood. There was a whole lot of work on perception of the neighborhood, the so-called obesogenic neighborhoods. How do people view them? What are the features of the obesogenic neighborhood? Is it the traffic noise, the walkability, the graffiti, all kinds of stuff. What we found, we had those data actually, because we, for each of our respondents, 2,000 respondents, was asked, within a 10-minute walk of where you live, is there a supermarket? Within a 10-minute walk of where you live, is there a grocery store or a fast food? And then we ask questions about how do you like your neighborhood, what about traffic and noise and so on. And each of those factors was actually captured by property values. So, for example, if we were looking at perception of the neighborhood, for that respondent at that address, we also knew the mean value of the properties within 10-minute walk. This is a non-contiguous sampling frame, which means the respondent can be living any place. But if they gave a given response, we knew what the value of the property was. So of course, attractiveness of the neighborhood, check, $100,000 more. Clean neighborhood, $73,000 more. Fast traffic, or traffic is a problem, $25,000 less. Which means all of those responses that you get about the perception of neighborhoods are completely linked to socioeconomic status. So this was interesting to us because we're really looking at how can we capture those multi-dimensional perceptions of the neighborhood in a single variable, and it happened to be property values work beautifully, even people knowing each other and trusting each other, so-called social capital. It was linked to real capital. So the question that of course arises is obesity predicted by where you live? And here we were very lucky to have Michelle come and work with us because she brought those beautiful maps of Cameo from Britain. That group has been stratifying American society on a number of socio-demographic characteristics at the level of the census block. And this was a map that she drew up for Seattle King County, looking at the various components. It was actually a 10-point scale with a kind of fancy marketing names, American aristocracy, free society, and so on and so forth. But this is pretty much a 10-point scale of demographics. And then she used our data to look at obesity for each of those demographic areas using our data from the Seattle obesity study, which would be aggregated to any level of aggregation because we had actual addresses. So what we noticed here was that Michelle's classification by Cameo and our property value maps were in fact very similar. And the Cameo, I think, is based on a number of dimensions, including property values, but also all kinds of demographic things. Going back to the Sing index is a very complex algorithm. But we thought, can we mimic this algorithm using nothing but deciles of property values? So then what we did was to do a comparison. At the individual level, we said, what is the link between tax parcel property values and obesity rates? We found that in regression models, again, looking at individual level data and individual level tax parcel values, we found that property values actually predicted obesity as well as education, and by the time that you had both education and income, education and property values in the model, income fell out. So actually the two most predictive factors are going to be property values and education, of which we like using property values. If it's objective, we just get those data, plug it into the model, it's fine. So here, what we were able to do is to look at deciles of property values from Seattle King County and deciles of property values from our own SOS study for the 2,000 people. And somewhat to our surprise, it was a perfect match, which means the range of deciles for 6 million dwellings in Seattle deciles, and our 2,000 people corresponded, which means we were then able to populate our map by assigning a prevalence obesity rate to each decile. And so here you now have the first ever map of obesity prevalence by census block using modeling based on deciles of property values. So, and this is how it looks. Again, it's a model. It's a very similar model to what the CDC has been doing at the level of counties. We are not using Markov chain Monte Carlo modeling. There are very sophisticated ways of doing microsimulation. This is not one of them. This is microsimulation based on a single variable. But it's kind of interesting to see how this looks. And again, this is a map of obesity at a very, very fine level of geographic resolution. Then what we found was that house prices also predicted diet quality, which actually is interesting because that opens the door to spatial nutritional epidemiology. There are many measures of diet quality, Healthy Eating Index 2005, Healthy Eating 2010, Alternative Healthy Eating Index, and so on, and there are plenty of studies in the literature on those, but none of them ever have been geocoded, which means we know what people eat and we also know where they live. So using the same exact technique, we're now able to map diet quality for Seattle King County at the census block level. So this is like a reverse of the traditional paradigm, because the traditional paradigm has been based on the environment, food deserts, distance to supermarkets, presence or absence or density or counts of food sources in the environment. And we're saying here, never mind about those, what is the resultant quality of the diet of the population based on where they live, and after that we'll check where they go to shop. But this is again modeled diet quality at a very fine level of geographic resolution using kind of Michel's method of forcing measures by decile of property value. So the same kind of modeling technique that has been used before. We like the results. Again, those are just illustrations. You would not use those data to do any further calculations. This is as far as you go to show how the results look. Those are model data not to be used for any kind of further calculations. And so this kind of brings me to another component of this presentation, and that is that we have been looking at access to healthy foods in these studies very much in terms of geography, and perhaps not enough in terms of economics. So I have been thinking of ways of how to slice up the food environment, and most of the studies that you have seen so far, I probably would describe as geographic studies of the food environment, and they're mostly static or, to say, home-centric and GIS-based. So we look at presence and counts and densities and distances within the buffer of home and occasionally within the buffer of work. And transportation people actually came with this innovation, which is now spreading, and I think Cambridge and people here in the UK are perhaps a bit more advanced than we are over in the US, looking at activity spaces where instead of using GIS, use GPS tracking devices and track people as they go, and their neighborhood is where they go. So different measures come in because now you have distances, density analysis, polygons, patterns, and so on, and this is how we look at the more active environments. But again, there is a gap when it comes to looking at economics. For example, here I divide things into supply and demand. The supply will be the food sources, usually stratified by cost. And then the demand, which is the personal attitudes, beliefs, importance of nutrition, and so on. We shouldn't be forgetting about those either. So this is like a 2x2 division: geographic, economic, static, dynamic, supply, demand. It's a kind of way of characterizing the studies that have been done, and most of them in the literature so far will be geographic and home-centric. I think the activity space is still a relatively novel and new technique. We're just beginning ourselves. So when we started doing those analyses, we found, much to our surprise, that when we look at our data from now SOS1 and SOS2, we find that diet quality of our respondents was completely unrelated to the distance or count of supermarkets in their immediate area. So there was beautiful maps here done by a student of Andre Nemudon, which was looking at Whole Foods, an expensive store in Bellevue, and beautifully mapping time and mode of transportation, 10-minute walk. So this is like mapping food deserts. You know, this is people within the red kind of cross are the ones who can walk to Whole Foods within 10 minutes. The next one is 20-minute distance to Whole Foods, your street distances as opposed to airline distances. And then you have 10-minute bike ride, as being Seattle at bike ride, 10-minute transportation, very sophisticated analysis looking at bus routes and timetables, connecting it up to the store, and then access by car. And none of this made any difference. So my take on the transportation mode is very different, actually very cynical. My point is, if your mode of transportation is a Mercedes, you have nothing to worry about. So it changes the transportation issue into a socioeconomic issue again. And this is, to some extent, because food sources locate by selecting their consumers and not vice versa. Again, going back to the map of Seattle, here you have supermarkets, really good coverage, but take a look at the distinction between, say, Starbucks to the north and fast foods to the south. So supermarkets serve pretty much everybody, but Starbucks and fast foods select slightly different populations. Actually, a better map is one that Pablo gave me a while back, and I love this one because this is a dramatic illustration of how the rich and poor shop differently in the Bay Area. You pretty much see Whole Foods on the left, it's Stanford, Palo Alto, and then you see Walmarts on the right in Oakland and in poor areas, and it's exactly what you see. It's a huge demographic split, and this is where the various food sources locate. There's no coincidence there. So we're looking at this geocoding, and what we're able to do with geocoding is that we can now look at the various supermarkets by name, going from inexpensive to more expensive ones, going from Albertsons and Safeway to Whole Foods and Metropolitan Market, and look how the market share changes with income and education. So this is like a combination between, say, Aldi and Waitrose, which means that you can be in the UK driving a mile to Aldi or driving a mile to Waitrose. In both cases, it's a mile. That's a world apart. It's completely different. So again, how do we capture the underlying socioeconomic differences, given that in both cases the distance is a mile? What do we do here? How do we have this second level of analysis superimposed on the geographic location? So here we show a very nice socio-demographic split by supermarket type. And then, of course, attitudes come along with that, because again, people who want their food to be healthy will be less likely to go to Safeway and more likely to go to the more expensive stores. And of course, they live in richer neighborhoods where those stores are in the first place. And then if they want to have their food to be inexpensive, you go to different kinds of stores, so the attitudes matter as well. You get into all kinds of data here, because now you have data on location, geography, transportation, economics, and so on, and all those things that we reconcile. And then we actually can code. We can code using Moran's eye, whether or not people with a given attitude live surrounded by neighbors who have the same attitude. So now we're looking at clustering. So these are many, many ways of looking at the data, going all the way from regression to clustering analysis. And again, we see where the people are who want their food to be cheap, South County, and people who don't care live around the lake. And then we're doing something similar, and this kind of brings up the importance of international collaboration. We're very happy to share some of our data and talk about the results for Seattle, because Seattle, it has to be acknowledged, is not like other cities. People shop by car, they shop about once a week, they don't necessarily walk to the supermarket. But so we selected another city for comparison. This was, of course, Paris, and many reasons for that. We had a collaborator, Basil Sheks, who has been doing similar geolocated studies in Paris, looking at supermarkets and shopping. What Basil was able to do is provide us with some French data for comparisons. He had a very nice study of the population in Paris in selected arrondissements, not all of Paris, and then these are the food stores in Paris, all geocoded. And of course, one important thing was that in Paris, people live in greater proximity to all kinds of food sources. So whereas in Seattle, we're about 2.5 kilometers from any store, in some cases 7 kilometers from a low-cost store. In Paris, a food store is rarely more than 500 meters away. So people do walk, they don't drive, they shop differently. Paris property values are higher than Seattle. All of those things are very, very different. Frequency of shopping is different, everything is different, and so on. But when we put everything into a regression model, just take a look at things underlined in red. The same factors apply. Obesity in Paris and Seattle is accurately predicted by property values and shopping at high-end supermarkets. The distance to the supermarket made no difference whatsoever. So again, this kind of shows the universality of the socio-economic determinants of health. So let me start concluding here, because there's a big problem, which has been identified by previous speakers, and that is that most of our measures are home-centric, and that is not good. So when we look at, say, Seattle, we look at homes, we look at buffers from home. That clearly does not capture what people do, where they go, where they shop, and we should perhaps give up on the home-centric measures of the environment. And of course, we are doing exactly that, and this is, I say, this related to nutrition epidemiology. We're actually looking, going from GIS to GPS, and now we're looking at GPS tracking. So again, these are traces of GPS, people living in a given area, taking a bike around Mercer Island, or taking the bus up and down. We track them using GPS tracking. We track them as they walk around the University of Washington. And in some cases, those traces are very revealing of what people do. In other cases, they're extremely boring. I took one of those GPS tracking devices and carried it with me for an entire week, day and night. This was a week when I was writing a grant proposal. And so this was it. So you see, this goes from my home to work, lunch at work, I stop by on the way to have like a donut and a coffee at Starbucks. I go back, and this was it for a week, so it's not very interesting. But when we start looking at many, many people and much data, then things start looking like this. Exactly, this is what big data look like. So what we did in SOS2 is to give GPS tracking devices to 500 people for a week, capturing their position with respect to 24 satellites every 10 seconds, which was way over, huge overkill. So that gives you immediately 25 million data points, and if you really want to expand on this, you very rapidly into 250 million data points, and so now you're talking big data. And we thought that patterns would emerge. Clearly, there's going to be a difference between obese, non-obese, diabetic, non-diabetic, and so on and so forth. Well, let me tell you, patterns did not emerge. Everyone went all over the place. How can I show this little video? Help me up here. So let's see that. So yes. Yeah. All right. So yes. So what do you do with big data? You do a video, you set it to music. So this is time 4 a.m. The city is waking up. The blue areas are where people walk, the white tracks where they drive. someone who's driving and taking the stairs. See that? So there you have it. That's big data. What do you do with big data? As I say, make a video, set it to music. There are no patterns. People go every which way. If you can identify patterns, be my guest. Those data will be available. Something with them. Actually, I was told that the only people who could analyze something like that would be the National Security Agency. Interesting, we could get more about that later on. So this is what you have. So let me just go back and see if I can go back to my presentation here. So just to summarize, the food shopping dynamics, this is what we're finding on yes. So Seattle, people shop by car. People shop once or twice per week. They do not shop nearby. They go all over the place. Socioeconomic status drives store choice. Store choice is linked to body mass index. Positive attitudes do count, so it's not just economics. And then we have this nice finding that when people buy food and cook at home, the diet quality is actually better. So we're kind of looking at the attitudes and behaviors. And then the healthy eating index and so on does, diet quality does vary by socioeconomic status. So here, we're looking at a different way to approach things from the epidemiology. I just want to wrap up using epidemiological research. When we look at things from the epi perspective, most people are interested in linking diet to obesity or diet to health outcomes, adjusting for the inconvenient variables in between. My point is, having been sensitized to the issues of socioeconomic disparities, is to reverse this and look at socioeconomic status as being a potential driver of obesity, and then look at diet quality and the food environment with kind of adjustment variables. So the kind of model that we're working off, and I'll finish here, is that the approach to obesity prevention would be to look at the individual socioeconomic status, education, income, home location, that's where the big data come in, and then of course many big data on food purchases, food environment, restaurants, receipts, shops, courtesy cards, loyalty cards, and so on. And then a lot on physical activity, environment, walking, riding, biking, and so on. And here we end up with energy balance, but all those things are in fact interactive. But our studies suggest that we should really be putting socioeconomic status front and center. So the question then is, does it matter what you eat? And from the nutritional standpoint, it's kind of a bit disconcerting to say that our measures of socioeconomic status are so powerful that diet quality measures don't necessarily add very much to the equation. So we're still puzzling on that. So I'm going to finish here and suggest that there is a time now for some cross-national and cross-city comparisons, because the data for Seattle holds for Seattle, but it does not necessarily hold for New Orleans, Detroit, New York, Paris, and so on. There are a number of very context-specific effects, so we need to decide which of those effects are universal and which are completely context-dependent and limited to Seattle and Seattle alone. So I kind of would welcome input on those very topics. Thank you.
Thank you very much. It's a really interesting and entertaining talk. And actually, we do have quite a good amount of time before we break. We're going to have a bit of a break here in about 10 minutes. Okay. But we've plenty of time for questions about the talk.
Okay.
Yes.
I think here you didn't talk much, but I think there might be aspects related to peer effects. probably the location where people are, where I believe that actually if you are surrounded with people that are obese, and actually you're much less conscious about the need, for example, to change your diet aspects.
Oh,
and I
yes.
believe that actually there will be some incentives with areas, and I don't know how we could study this, but I think...
No, this is very interesting. So one question has been, is in the literature, whether or not people select to live in a given area because of they want physical activity, they want access to healthy foods and so on. We actually looked at that. We had data on that as well. Why did you move into your neighborhood? And of course people said close to work, close to school, aesthetics, access to healthy foods and so on. Well, first of all, those data stratified by the value of the property like you would not believe, because then we stratified them into property values. So people in $3 million homes never mentioned money. They moved there for aesthetics and being able to walk and run. People in $300,000 homes said it was what I could afford. So again, those are not universal values, they completely stratify. So people, you know, as I say, with money never mention money. And yet, other people did. So, just said. So you're absolutely right that all the socioeconomic data really reflect the pattern of housing segregation. That's exactly what it is. And Seattle is not that segregated, but other places are. And you will see dramatic differences in other places. Seattle is kind of not that segregated. There are rich areas, there are poor areas. There's a general pattern that's not as dramatic as I see in New York and Manhattan, where 96th Street is the dividing line between the rich and the poor.
I think Jane was next here.
Okay, sorry.
Thanks, very, very interesting. I can see how the kind of the association of the house price is using to explain variation in a place. But obviously what's also interesting is the variation between places. Do you think you can use, does the data work in the same way? Can it be used to explain differences between places as well?
Between places, meaning that geographically distinct but socioeconomically similar?
Or geographically distinct and socioeconomically different? Can you explain why one area in the country has a high level of obesity and another area in the country? You know, because that is not going to explain what you're looking at is the internal kind of variation by house price certainty within Seattle or within Paris.
No, it kind of
explain between Paris and Seattle. Can you use it?
Okay, but for example, if you look at Mississippi or Alabama, those are going to be very low-income counties with very high prevalence of obesity. What's surprising to us is within King County itself, which is rich, we still see pockets of obesity that no one was suspecting, geographically determined, which can only be uncovered through small area studies. So this is like a first demonstration. Even within a rich country, we still have the rich and the poor, and obesity rates varying by a factor of 6. So it's kind of amazing.
Are you asking, James, whether that same contrast exists in areas that are completely socioeconomically different or geographically different? What is?
Yeah, I mean, I guess you will have higher income areas, I guess, particularly in different countries, where you're going to have similar kind of average level of socioeconomics, and obviously house prices are going to vary a lot based on other contextual factors, and you could be relatively poor in London, but it would be an expensive house. But you're going to can you explain that the differences between areas? That's going to then the kind of built environments and other factors are going to start coming in, determining why some regions will have higher levels of obesity and other regions.
That's a good point. So the question is whether or not, say, access to resources and services is completely tied to the socioeconomic status of an area. That's one way of looking at that. And it doesn't have to be, but it kind of usually is, which means, as I say, the fast foods, the supermarkets, different types of supermarkets will follow the purchasing power. So in many ways, the research that we do, which is health-oriented research, is actually indistinguishable these days from marketing research. Because people are looking at, say, marketing power by area, we look at marketing power and purchasing power, but we also look at health outcomes. So we actually go one better than the marketing research, because we actually do have health outcomes on all of those people. So we can look, for example, at who lives where, what supermarket they shop at, what is their diet quality, and what is their health outcome. In SOS 3, We are now in the process of recruiting a longitudinal cohort, which means our studies will no longer be cross-sectional. And that is hugely important because I think every single study in the built environment area has been cross-sectional. So no causality, it's all correlations.
We have time for one more question before the break, but then Adam will be on a panel later, so can we take one more? Was it Janet?
Well, sorry, but no, I've got 3 questions, but I'll just ask one.
Just ask one.
Yes, I'll ask one. It's all really very interesting, very useful for policy and so on. It's a bit more of a technical question really about the healthy eating index and your predicting diet quality, function, food deserts and so on. And the map looked, distinctive because you've got obviously your red, your green, and so on. But the actual range was rather limited within the index from 68.7 to 73.4, which is really quite a narrow range. Is that an important difference in healthy eating index?
It is, but you're absolutely right, it is not representative of the country. It is much higher. Our average for Seattle was way higher than the national average. The national average is something like 56 or even less. Whereas our average was in the order of 65, 70. That is a function of Seattle, which is kind of rich, educated, nutrition conscious, and of course our study itself. So we still were getting disparities, but the average was much, much higher. This is one reason why in SOS 3 we're actually going to Yakima, 90% Hispanic, in Pierce County, down south, with a very high proportion of low-income people, just to, again, get away from the rich Seattle and find out how real people behave.
So you might get quite different...
We absolutely might, yes, that's what I'm saying. This is not specific to Seattle. We would like to do a comparison with another city, another location, different demographics.